You remember when people were telling you that these vaccines would stop transmission and the rates of protection were greater than 90%? Well, guess what? Here we are about 10 months afterward, and we're finding that the data are showing that some of these vaccines, the protection from infection is less than 40%, and even less than that for some of them. As we now know, these vaccines are not preventing transmission. So sure, they reduce the likelihood of transmission, and even that is sort of questionable depending on how far out you go, but they're not preventing it. So this idea that, I've heard some leaders say things like, we'll create safe workplaces by mandating these vaccines. Well, they're really decoupled, because the infections can still happen whether people are vaccinated or not. I mean, that's very obvious, And you remember, these people were also telling you that all these breakthrough infections were rare. Well, they're obviously not rare. In fact, they're common. And so that's the truth. So this idea that the vaccine mandates are needed to create safe workplaces is a complete lie. It's continued to be repeated, and you should know that it's not at all backed up by science. In fact, the science says something that's completely the opposite. And that's a fact. Part of the reason that some people are not comfortable with these vaccines, is because the climate of dishonesty, scientific dishonesty about the science, right? Whether it's natural immunity, denial of that in the face of data, or in the case of the vaccines, open, honest discussions about both effectiveness and safety. There's been dishonesty around that. The reality of how safe these vaccines are is absolutely not public. Healthy people who've had adverse reactions after the vaccines, there's been a concerted effort to prevent these types of stories, these experiences, from receiving the attention that they obviously should receive. It's completely ridiculous. Many Americans can sense that there's total dishonesty about the safety of the vaccines. That's one of the things the governor and I are going to work on.